Anyone without medical training can now help a loved one who has overdosed on prescription drugs and heroin. Police are now equipped with Narcan, and you can be too by picking it up at a local healthcare center. Carol Reed tells us about the new campaign to combat addiction.
In public health and substance abuse treatment and prevention, we're currently faced with an opiate addiction epidemic and an opiate overdose death epidemic. Our nation and our state has responded through the CDC and the Massachusetts Department of Public Health to alert and inform communities on this public health issue. So what we found in Massachusetts and in Norfolk County is that part of the 61 overdose deaths, almost half or more of opiates are painkillers and or heroin. And there is not one community in Norfolk County, according to DA Morrissey, that hasn't had an overdose death in 2013. What we are fortunate to be able to do during the past 2 years, especially here in Massachusetts, is to offer first responders as well as families Narcan. Nasal naloxone, or Narcan, is actually an opioid reversal agent. So what happens is, if someone encounters someone they care about in their family or a friend that they think may be overdosing on an opiate or heroin, you can absolutely follow a protocol that has been proven based on a pilot in Massachusetts to work when using Narcan rescue kits. As we do with EpiPens, you always call 911 first. And while you're waiting for your rescue and EMT personnel to come, this is when you're going to administer nasal Narcan. You open up this atomizer and turn, this is the liquid, and you turn this and put it on here and put the nasal thing on it and squeeze one and the other half in the other nostril. And this takes about 3 minutes to work. It's imperative to know that each kit comes with 2 vials, so that if someone doesn't respond to the first vial, you'd repeat the same thing. Put it in one nostril and the other nostril. These kits turn and take the drugs off the receptors, and the person will wake up. It is imperative, as I said, then for the person to get to the emergency room and to get examined, because people can go back in 30 minutes or so into overdose.